Joining us now live, Dr. Anne Rimoin, Associate Dean for Global Health and Professor in the Department of Epidemiology at the UCLA Fielding School of Public Health. Great to have you back on the BBC. We heard that warning from the WHO that Ebola now growing exponentially in the north and in the east of the DRC. What exactly does that mean, and how concerning is that?
Well, thanks for having me and for talking about this really important topic. Right now, we are seeing Ebola just really continue to take off. And this is because we started behind this virus. We've been chasing behind it ever since. Ebola, once you start having chains of transmission, and particular chains of transmission that you don't actually know about, it's very hard to stop and get in front of. We've had challenges because of testing. This is a different strain of Ebola, or a different species of Ebola that we normally are used to dealing with. We don't have the widespread testing capacity, and we don't have the vaccines readily available to be able to do ring vaccination and really stop it in its tracks. And then in addition, as you mentioned, we've got insecurity, we've got very poor health infrastructure, poor roads, poor health services in general. So it's a really hard issue to be able to get in front of.
Let me pick up on one factor you mentioned there, and that's vaccines. And as we know, there is no vaccine currently in place that would be effective against this species of Ebola. There is a vaccine for a different species. It's now being tested, in fact, within the DRC. There's tens of thousands of doses being deployed there, which is designed for the Zaire species. How big of a deal do you think it would be if it turns out to be at least somewhat effective in preventing this current strain of Ebola?
Well, you've hit the nail right on the head here. It is manufactured for a different species of Ebola, but that does not mean that it won't necessarily have some protective capacity here. And we can't let great be the enemy of good. This is what's really important. So we have these vaccines in the stockpile right now. They're being released, and they're going to be deployed in a manner where they're going to be testing to make sure what the effectiveness is here. So they're going to be doing a study and making sure that we really know how well they work. There is some evidence already that there's cross reactivity between many different species of Ebola virus, including work that my team has been working on. So this is really important, but just having cross reactivity doesn't necessarily mean cross protection, and that's what we need to find out now.
We hear a lot about mistrust within local communities there around the virus, around Western aid workers. When it comes to something like a vaccine, and let's say that this does prove to be somewhat helpful, how difficult would it be to deploy that to the population? Is this something that people would readily take?
That's always a problem, right? You can have a vaccine available, but then you actually have to get it deployed into the population, and you have to have the population be willing to accept it. There's a fair amount of evidence from other Ebola outbreaks that this vaccine will be pretty well accepted in the community, but we are dealing with an area that is fraught with conflict, and so there are a lot of barriers to being able to get it out. I think that if we can start getting this vaccine into populations where, it's the best that we can do, but there's going to have to be a lot of work in the communities and a lot of work with all of the political factions that are at play there to be able to get those vaccines out. The good news is that the DRC is very used to this kind of a situation. They know how to deal with it. They have experts on the ground, local experts, and a lot of experience in this dealing with Ebola.
We just have 20 seconds left here, but now around 2,500 people have died in this outbreak 3 months on. How do you see the current situation, and will they be able to bend the curve in the next coming weeks or months?
Ebola is stoppable if you have the right tools in place. And just like I said, the DRC has a lot of local experts who know how to deal with it. So getting these vaccine doses out, seeing if there's going to be any protection given by these is going to be really important. But then it's not just about vaccines, right? You can, there are barrier nursing protection that you can use. You need to have good access to PPE. You need to have infection control in place. You have to have good surveillance to be able to, if you identify cases, you can isolate the cases and then contact trace and figure out who's been exposed. All of these things are doable. It's just a function of making sure that there's funding available and human resources available to be able to make these things work. And that's how we're going to get in front of it.
And Rimoin from UCLA, always great to have you on. Thank you.
Thanks for having me.